How do I know if I have thrush or a UTI? Thank you so much for joining me. So let's get started into the content today. So is it vaginal thrush or is it a UTI? And UTI is short for urinary tract infection. So you might feel discomfort in your nether regions. So it might be around the vulva, which is the external part the vagina's on the inside, vulva's on the outside. So it's the tissue on the outside of the vagina. Or you might feel discomfort around the urethra. So remembering the anatomy or the female anatomy is urethra at the front, which is the tube that goes from the bladder to outside your body. So the urethral opening is first, then the vagina second, and the anus is behind that, just to give you a bit of perspective there. So when you have a UTI or thrush, it can be difficult to distinguish between the two because sometimes there can be similarities between them, but technically there are differences in symptoms. So we are going to go ahead and discuss that today so you can have a bit more of an understanding of which one you potentially have. So let's go ahead and talk about that. Before we do, for those of you that don't know me, my name is Michelle Cooke. I'm a hormone and fertility naturopath. I'm a natural fertility educator, and I'm a naturopathic emotional release practitioner. And I have a clinic based in Melbourne, and I see patients online and face-to-face. If you have any questions or comments as we go through the live this evening, be sure to pop them in the comments box down below, and I'd love to answer those for you. Or if you're a bit shy, you can pop them in the comments there and I can actually answer those for you later. Or you can send me a DM or PM and I'm more than happy to answer those questions for you. So let's get started. So let's start with vaginal thrush because that's what we're referring to. So what is thrush? So thrush can basically occur in various parts of the body. So it can occur in the vagina, in the skin, in the gastrointestinal system, so in the mouth, in the throat, and in the gut generally as well. But today we're going to be talking about vaginal thrush particularly, and it's known as vulvovaginal candidiasis. So vulvovaginal candidiasis is when there's thrush or there's a yeast overgrowth or fungal overgrowth. Commonly it's Candida albicans, that's the type of yeast or fungus. But there's also one known as Candida glabrata, but that's sort of less common. It's more likely to be Candida albicans. So Candida albicans is usually the most common, as I suggested. It's usually about 85 to 95% of people will have this particular strain of yeast. And generally there'll be an inflammation of the vulva. So that's the entrance to the vagina, so the tissue outside the vagina. Inflammation there is also known as vaginitis. So anything with itis on the end, it implicates that there's actually inflammation going on there. And it's completely healthy and normal to actually have Candida albicans in the body. So don't, diss Candida. We definitely do need it. It's normally found in those areas that I mentioned before, so in the vagina, in the skin, in the gastrointestinal system as well, so gut, mouth, and throat. So it's normally found there, but it's known as an opportunistic organism, which means that in the right situation for that particular yeast and given the right opportunity, it will actually take advantage and actually try to dominate, arising in overgrowth of that yeast. And that's when it causes problems. So when there's too much of that yeast, that's an issue because it's all about real estate everywhere really in the digestive system and the vagina, bacteria and fungi, etc., are all fighting for real estate or space there. So if there's space for it to flourish and grow, of course it's going to take advantage of that. So let's talk about some signs and symptoms of thrush or vaginal thrush. So you might be experiencing itchiness there at the vulva and or vagina. That's probably one of the most common symptoms. There might be an unusual vaginal secretion. So there might be thick, white, or yellowish cheese-like discharge or secretions. So a bit like cottage cheese consistency, or it might be sort of extra watery. There may be a burning vulva or vagina. So again, remember, vulva is the exterior part outside the vagina. Vagina's on the inside. Or you might have a sore vulva and or vagina. You might have swelling or redness of the vulva and or vagina. And painful urination or stinging when you wee, that's common as well. It's called dysuria technically. Painful sex is another one too. So dyspareunia is the technical name. And you may or may not have all of these symptoms. You may have a few, but not necessarily all of them. Sometimes you can actually have cracks or splits in the vulvar tissue, so it can actually split and sting a lot when you urinate, etc., when you're wiping the area generally. So how can you actually get thrush? So there's a lot of risk factors involved. So high estrogen situations, so when you're pregnant, for example, the estrogen's quite high then, and that can increase the risk of thrush. And estrogen increases this type of sugar known as glycogen in the vagina, which is ideal for the candida because it actually feeds off that and it thrives and overgrows. Medications, so there's certain medications that can increase estrogen in the body. So things like oral contraceptives, like the combined oral contraceptive pill. Remember, that's a form of synthetic estrogen, but nonetheless it's still increasing levels of estrogen in the body. Estrogen therapy as well, so including vaginal estrogen cream for menopause, for example, that can also increase the risk. Other medications, so if you're on immunosuppressant medications which suppress the immune system, so you might be on something for lupus, for example, which is an autoimmune type condition, that can increase the risk. Antibiotics, so they are effective at addressing and treating bacterial infections, and they are necessary in particular scenarios when it's caused by bad bacteria. But the thing is, they actually disrupt the normal healthy vaginal flora, so the good bacteria that is found in your vaginal area, which results in the candida or yeast overgrowing. So what I was trying to say there was, normally you'd have good bacteria to fight off this excess candida overgrowth, but if you're using antibiotics, it's killing off some of your bad bacteria, which will affect your immune defenses there. So I hope that makes sense. Now, medical conditions and issues, that's another thing that can arise in thrush as well. So diabetes mellitus, so if you've got diabetes and it's pretty poorly managed, obviously that's associated with high blood sugar levels and high sugar levels in the vaginal area as well, which is a perfect food source for the candida. And also those with diabetes tend to have sort of poor immunity, and that's due to the high blood sugar levels as well. So again, your defenses are down, so it's a perfect opportunity for that candida to move in and flourish. Being overweight can increase the risk, having low iron, poor immunity or immune system disorders or conditions, because there's nothing to keep things in check there. When you're stressed and run down, that leads to poor immunity, so that can increase the risk as well. Topical vaginal products, so this is a biggie, so things like douches, and that's because it disrupts the pH of the vagina. So normally the vagina is acidic, and having this type of environment stops bacterial and fungal overgrowth there. So if you're using a douche, that's going to disrupt the pH of the vagina, making it too alkaline, and then it's more susceptible to infections, so bacterial or fungal infections as well. You have to remember that your vagina is self-cleansing. It cleans itself. You don't actually have to go in there and use something to clean it, because it would actually do that job. But if you're experiencing, a bad odor there, or, an unusual sensation or a bad smell, that's when you'd think about going to your GP, because it can generally indicate that there's some form of infection there potentially. So make sure that you actually get that assessed. Intimate washes or wipes and deodorants and vaginal perfumes, etc. Don't use them around your vagina or vulva either, for the same reason. It disrupts the pH of the vagina, increasing the risk of infection, whether it be bacterial or fungal. Spermicides as well, for exactly the same reasons as above, so avoid those. Now, how is thrush actually diagnosed? Well, generally what you would do is go to your GP and get a vaginal swab done, okay? So they'll get you to do a little swab around the exterior of the vagina, so around the vulva, and then inside the vagina as well. And that will be sent off to the lab, along with an actual physical examination or observation of the area of the vagina and vulva as well. Now, urinary tract infections or UTIs, so let's talk about them. So what is a UTI or urinary tract infection? So it's an infection that takes place anywhere in the urinary system. So the urinary system consists of your bladder, your kidneys, your ureters, which are the tubes that go from your kidneys down to the bladder, and the urethra, which is the tube that goes from your bladder to the exterior of your body. So that's what the urine comes down through and exits the body through that. Now, the most common type of urinary tract infection is through the bladder, so that's known as cystitis. But it can also occur in the urethra, so that's known as urethritis, or the kidneys, so pyelonephritis is what it's called technically, or it could be a combination of those things. It is absolutely vital to get treated as soon as possible if you're experiencing symptoms of UTI, because kidney infection is very, very serious, so you don't want it to actually travel up to the kidneys and infect there. It's very serious. So the signs and symptoms of a UTI, so you might not have all of these, you might just have some of them. So you may get pain in the lower back or in the sides, and that indicates it's potentially in the kidneys, particularly if you're getting that pain in the lower back. You can get an uncomfortable feeling in the lower tummy area, so it's technically around that sort of bladder area, and that indicates it's in the bladder. Your wee is quite smelly or has a quite strong odor. Your wee is cloudy or it's quite dark yellow. There may be blood in your wee, and that can indicate infection in the bladder. When you do a wee, it actually burns or stings, so that can indicate the infections in the bladder and the urethra. You might have a fever, that can indicate it's potentially reached the kidneys. You might have vomiting, again that can be associated with infection in the kidneys. Nausea, same deal. After you do a wee, you feel like your bladder's still full and you need to go again. You have the urge to wee often, that can indicate the infections in the bladder. You do a wee and it's only very small amounts, that can indicate a UTI as well. So what is the actual cause of a UTI? So it's due to actual bacteria entering the urethra, so that tube that goes from the external part of the body up to the bladder. So women are more likely to experience a UTI than men because the urethra is quite short compared to men. And also it's in close proximity to the anus. So there can be a lot of bacteria hanging out around the anus, and it's easy then for it to translocate into the urethra because it's quite a small distance between the two areas. Infection Okay, so infection of the bladder, let's talk about that. So that's usually caused by E. coli, which is a certain type of bacteria that's found in your gastrointestinal system. But other bacteria can actually result in infection of the bladder too, or a UTI, but this is probably one of the most common ones. And as I said, because the urethra is so close to the anus, bacteria can easily travel there from the anus to the urethra and up to the bladder that way. Infection of the urethra, so this can occur due to two different reasons. So when bacteria from the gastrointestinal system spreads from the anus to the urethra, that's one reason. Or it can be due to sexually transmitted infections. So it could be due to gonorrhea, herpes, mycoplasma, or chlamydia. And that can occur again because the urethra is close to the vagina. Because remember, they're all in a line next to each other, so it's easy for bacteria to translocate to different areas there. Now, risk factors of UTI, so that can be due to diabetes mellitus, because there's poorer immunity there, so you're more susceptible to infection occurring. Menopause, because due to the decline in estrogen levels. Being sexually active as well, because the urethra is actually close to the vagina, so it's more prone to infection. Poor immunity, so if you've got diabetes or other medical conditions that affect your immune system, it can lower your body's defense against nasties in the body. Contraceptive use, so use of diaphragm and spermicidals can increase the risk. The use of feminine hygiene products, so again, things like douches, deodorants, wipes, etc. So please don't use those. Holding when you need to wee. This is a huge one, and I see this quite often with my patients. So you're working away and you're just thinking, oh, just get this one last thing done, and you're holding. This can actually increase the risk of having a UTI because it gives the bacteria, potential to actually grow and multiply in the bladder because it's not being excreted, it's just kind of hanging around in there. So that residual urine will actually have bacteria that will be having a bit of a party in your bladder. Not drinking enough water. So this is really, really important because we need to be flushing the kidneys through and the bladder through. So we need to make sure that we're consuming enough water and being hydrated, because we need to actually send that message to the brain that the bladder's full and we need to wee. So we need that to be happening more often. And as I said, it can lead to bacteria multiplying then in the bladder if you're not going that often, which increases the risk of infection. So how is a UTI diagnosed? So generally it's diagnosed by a GP. So they'll do a urine test, usually midstream. So in the middle of that wee, you've just got to catch that sample. And that will be sent off to a lab as well, where it's examined under microscope and they're looking for signs of bacteria or white blood cells in the urine, which both mean that there's a sign of infection there. The GP will also look at it in-house as well, and he'll see if it's cloudy or if it's got any signs of infection, but they also usually back it up with sending it off to the lab as well. So, what then are the similarities of UTI and vaginal thrush? So, some of the symptoms of a urinary tract infection and vaginal thrush can be the same. So, it can be quite confusing to think, well, do I have thrush or do I have a UTI? So, and it's totally possible actually to have both at the same time. How fun is that? Not? Furthermore, if you're giving antibiotics for your UTI, this can increase the risk of getting thrush as well. So, yeah, not fun at all. So, some of the same symptoms are painful urination or stinging when you wee. So that's one of the common symptoms between the two, which is why when you see your GP, sometimes it can be difficult for him to ascertain whether you've got thrush or UTI or both. So just to double check, generally you'll get that vaginal swab done just to rule out thrush. And you'll also get a urinary test done as well to rule out urinary tract infection, just to make sure and to actually see what's causing that infection is as well. So the differences between the UTI and thrush. So they are totally different infections. We need to remember that. So vaginal thrush is a fungal infection of the vulva and or vagina, whereas urinary tract infection or UTI is actually a bacterial infection of the urinary system, so whether it be the bladder, the ureters, the urethra, or the kidneys. Okay, so apart from that one common symptom above, which is pain or stinging upon urination, they actually are quite different apart from that. And one thing that could be classed as kind of similar and difficult to differentiate is kind of that discomfort generally around the genital region. So you can kind of experience kind of a general burning sensation, and it's difficult to ascertain, is it the urethra, which is the opening to where the urine comes out from the bladder? Is it there, or is it, around the vagina or vulva? Sometimes it's hard to tell. So that's probably the two symptoms that are similar. But apart from that, they're quite different in terms of their presentation. So what would I recommend if you're not sure whether you have a UTI or whether you have vaginal thrush? So I would recommend going to the GP, absolutely, to rule out which type of infection you have, whether you have a UTI or thrush or whether you've actually got both. And the treatment is very different for either of those. So it's very different if you've got vaginal thrush, which is infection of the vulva and or vagina, as I mentioned, whereas UTI is infection of the urinary system, and it's a bacterial infection, so the treatment's very, very different. However, it's important to note that a naturopath can definitely help you with a UTI or thrush. There's plenty of herbal medicine, nutritional medicine, diet and lifestyle advice that can help you support your vaginal and urinary tract health and your immune system as well. If it's addressed soon enough, you may not need antibiotics for your urinary tract infection. However, acting fast is very, very crucial if you do have a urinary tract infection, because if you leave it too long to get help, it can be too severe for natural medicines to actually take effect and treat it, and it will require antibiotics to prevent kidney infection, which is very serious, as I mentioned. But keep in mind, though, you can actually combine both treatments. So if you are doing the medical treatment, you can definitely see a naturopath as well, and they can support you with herbal and or nutritional medicine and diet and lifestyle advice just to support your vaginal health and your urinary tract health as well. And if you get recurrent UTIs or thrush, a naturopath can definitely help you with that. So they can prevent prevent it from reoccurring again for you, and make sure that you actually get to the bottom of the core reason why it's actually occurring for you. And again, it's using herbal medicine, nutritional medicine, diet and lifestyle advice to support that and support your body as well. Has anyone got any questions while I'm here too? I'll just have a quick scan of Facebook and Instagram. If you're a bit shy, you can always ask me later as well. I do plan on, in the new year, actually doing more of a treatment and prevention kind of strategy for urinary tract infections and vaginal thrush, but it's a bit much to go through all of that today. I just wanted to show you what the difference are between the two and how you can distinguish. But obviously, don't rely on self-diagnosis. So don't think, I think it's vaginal thrush, or I think it's a UTI. I'll just take this over-the-counter product, because it can be quite serious if you think it's thrush, for example, and you take something over the counter to treat that, and it was actually a UTI. We don't want it to end up in kidney infection. So it's very, very important to go ahead to your GP to actually get it diagnosed, so you actually know, what you've actually got going on there. And if you actually need help with your vaginal health or urinary tract health, I would absolutely love to help you. So what you can do is actually go ahead and book a free discovery call just to talk about what would be involved in the treatment and how we would be working together and whether we're actually a good fit. So if you're watching on Instagram, the link is in my bio. If you're watching on Facebook or YouTube, I'll pop a link down below so that you can actually book a free discovery call with me, and we can see if we're the right fit and what the treatment will be working together. So I think that's all I've got to cover today, and today is actually my last live for the year. So I will be back on in the new year with some further lives on something hormone, fertility, menstrual cycle or period related. Usually I alternate each week, so I'll do fertility one week and then hormones, periods or menstrual cycles the following week, just to mix it up and keep it a little bit more interesting. But I'd like to thank you so much for watching this evening, and it's been a pleasure. If you're watching on my YouTube channel, be sure to like and subscribe so that you don't miss any future videos that come out. As I've previously mentioned, I actually pop these lives up onto my blog as well, which is reproductivewellness.com.au/blog, and they're all there. So I have the video and I have it all written down underneath. So if you're more of a visual learner, I've got it all written as well, and all the advice, if I do talk about advice in relation to the topic I'm talking about as well. So I look forward to seeing you next year on Wednesday, 7:30 p.m. Australian Eastern Standard Time, to discuss more about, things related to fertility, hormones, periods and menstrual cycles. I'll check in the new year and give you a heads up to when that live will be, but I'd love to take the opportunity to wish you a happy Christmas and also a happy new year. So take care, and I will talk to you then. Thank you so much. Bye.